A very good evening to you and a warm welcome to our program iMed. And on iMed today we'll be discussing mostly on leprosy to give you a better insight as to what this disease is all about. And to do the honors, we have with us a consultant community physician, Dr. Kapila Piyasena. A very good evening to you, Doctor.
Good evening.
And welcome to our program iMed.
Thank you very much.
And as I mentioned towards the beginning, that we'll be touching on the disease leprosy, and with this scientific term is also Hansen's disease.
Right.
So tell us more about this so that the layman who's tuned in right now would understand what leprosy is all about and
Yes.
why it's called the Hansen's disease as well.
Yes. And leprosy is considered to be one of the most the ancient disease that we have been called upon. The history of the medical literature, the leprosy comes as the first. There are so many literatures has been written on leprosy. We have seen people with totally disabled, lost their eyes, lost their hands, lost their feet, and leprosy colonies. And so many films we have seen that the leprosy colony, that people are being segregated into certain places, and leprosy colonies are there. That sort of picture has been given, and it has a dark, grim picture when we talk about leprosy. But now what I have to mention about leprosy is not that now at the moment. But people are still scared of leprosy.
So we're talking about history in terms
history
of
in the terms of leprosy.
So this dates back to
in 17 or some 1500. But our Sri Lankan history goes back to 1709, and we have the Leprosy Hospital, which was built by Dutch era. And that time first we diagnosed a prince from Dutch. The shipment, they found that one of the prince was positive on leprosy, and they had to keep him a place. Well, at that time, that era, there was no treatment available for leprosy. Only treatment available was to put them into a segregation, that is quarantine. Now what we talk here in COVID situation, 14 days quarantine is a big fuss on among everybody. Now if we have diagnosed a leprosy patient prior to 1950s, even 1709, at that era, we talk about lifetime quarantine, and they are not being able to go out. They not even the dead body can't go out, because even the cemetery and everything is in the hospital premises. Now what we see, at present we have the leprosy hospital, but the premises has been encroached by everybody. Now size has been reduced to about 3 or 4 acres area, but it has to be about 16-acre area. And but it's very nicely built hospital, because the Dutch has built is for a prince. And now later on, the number of patients in Sri Lanka has been increased dramatically. So there are so many patients. So I heard that in a smaller, say about 40 feet with about 100 feet area, there are about 800 patients who live there. And imagine now the mentality of these patients. They know they can't go out. There's no relatives they can later on can see in their life. And many of them go see the deterioration of other people by losing their hands, losing their feet, and losing their eyes, and then later they die. And many people commit suicide by jumping into the Canal River is the next time,
because they can't take it.
They can't take it anymore. So there are so many horror stories at the moment. Even people talk about in leprosy hospital itself. So that was a era leprosy came, and it was the person, the Hansen's. That's why they call Hansen's disease. Hansen's is the person who found the leprosy bacilli. Actually, leprosy is caused by a bacteria. It's not by the one that we are causing the viruses. This thing is a bacteria. Normally, bacteria we can counteract, but still they couldn't identify the bacteria because this bacteria is very slow growing bacteria. Leprosy bacilli is a mycobacterium genus, but leprosy species. There are many mycobacterium. When we talk about mycobacterium, we talk about Mycobacterium tuberculosis. That also that commonly we call TB. And those bacteria, the main thing is they grow very slowly compared to other bacteria. Now, just give a description of the severity of the dividing part of the bacteria. Normally, when we say a urinary tract infection, we see within 24 hours we see more than 1 million bacteria living in 1 milliliter of water, urine. But this bacteria take about 14 days to divide into 2. So, even that bacteria take about 10 to 14 days. So, with it, a huge body like us, who the bacteria is very small, tiny, need about more than 1 million or 2 million or 3 million. That will depend on the person's part and the bacteria virulence. So, there will be, you won't get infections as soon as you get the disease.
Right.
So, therefore, that's why
so it doesn't show up immediately. And that's why the leprosy is considered as a chronic disease, not an acute disease like what we see in the COVID situation, what we see in the dengue. It's a very chronic conditions. It takes about, maybe symptoms may appear in 20 years time. Normally what we say is about 5 years. People, literature has given us 1 year to 5 years, but if you consider as 5 years is the median. Now, when the disease comes to you, let's say the bacteria comes to your body, and the time that you show your symptoms of the disease is called the incubation period. And all the diseases have certain incubation period. Leprosy has the highest rate of incubation period. So that period, that 5 years, people just hang around, be with other people, but mind you, these people might be infectious. And the best so
part,
that's during the incubation period,
infectious. They can, how they infect? By sneezing, by coughing, with the droplets of nose, saliva or nostrils. The mucosa lives in the mucosa, and when you sneeze, it comes to the droplets and spread around all over, and the people can inhale. But mind you, leprosy, if you say 100 people, if I infected 100 people with sneezing this bacillus, 90% will have the immunity to counteract that.
Right.
Only 10 people will get the disease. So, therefore, we are somewhat immune to the disease itself. So, it's one good thing. But only thing is, once the 10%, it developed into a certain level gradually. So, therefore, that's why it's called a chronic condition, leprosy. So, leprosy is, when I give a nutshell of the leprosy itself, it's a chronic disease caused by bacteria, and it's mainly affected the mucosa, the peripheral part, actually the skin and the superficial part of the body. Skin and the nervous system and the eyes are the places that affected by the leprosy. So, when we are discussing the leprosy, all the symptoms and signs related to the leprosy comes on that superficial part of the body, the skin and the nervous system.
Let's talk about the symptoms and signs in detail, doctor, right
yes.
now.
Now, if I show you a picture of the this is a picture of the Hansen, and in 1870, I think he was able to identify the leprosy bacillus, and in the next slide, in the same slide, you can see that this small bit of pink color, purplish one, these are the bacilli. These are rod-shaped bacilli. Normally, bacilli are different types, a comma-shaped one, a round-shaped one. These are rod-shaped one. So, these are the bacilli in the when you see the slide. So, this is what identified by the Hansens. And if you go to the next slide,
we can have that on.
Yeah, next slide, and you see the disease affecting mainly the skin. You get a skin infection. In infection sense, you get a skin lesion. Commonly, we see when a thick, when a dark person comes, a hyperpigment. Like hyperpigment in sense, the less lighter than your normal skin color, a lesion. Normally, what we commonly call pityriasis. Like
you can play the slide, doctor.
Okay, we see like this sort of a lesion in your body, like the hyperpigment. The pigmentation is less than the normal skin. Same thing happening in this slide as well. Now you see this lesion is there's no symptoms as in, there's no scratching, there's no burning sensation or anything initially. What happening? You get only the skin lesion, and people not notice this as a condition at all initially, unless if it is happening in your face. Especially the girls who see a patch in the face, they immediately go and check it. But if it is happening in the body, Now this happen in the body in one part or in the other, or in the right hand side, the left hand side, or even the back even. So anywhere in the body you can have one or single lesions or multiple lesions.
Right.
So therefore there's no hard and fast rule, lesion has to be like this.
There's a specific shape, or is it like a specific shape in a circular shape?
No,
like
there's
that?
no specific shape as such.
Right.
Just a normal spreading, like what I'm showing you here, like the lesion what we see here.
Okay.
Right? And also if you can show this one, it can happen anywhere in your body. And now if I show you like the picture like this, now when we see a picture like, even a medical officer who comes to, this patient person goes to the consultancy dermatologist for initial part, they will go to the normal GP or a normal OPD doctor. Once they see this sort of picture, they immediately think this is not a leprosy. The first thing comes to the common conditions.
Common skin condition.
Common skin condition. It's like a fungal infection.
Yes.
So what happens is, normally what they do is they treat for the common fungal infection, antifungal, and then they'll be treated and not getting better. Maybe they come in 1 month's time. Ask them to apply the cream for 1 month. Normally that's the procedure. And if not applied, then they go for a second application. Sometimes a strong antifungal. Even that doesn't work. Combination, antibiotic and steroid combination they apply. Even that doesn't work. Only the doctors will think of what this disease is. It's not the normal fungal that we are fungal we are dealing with, something else. Then only they might thinking of referring them to the dermatology clinic. This is the only way we can diagnose leprosy is at the dermatology clinic, at the dermatologist. So until up to that level is our part is, and from the anti-leprosy campaign part in Sri Lanka, what our aim is to refer these patients to the dermatology clinic. Now if you are not being diagnosed early in this part, what will happen? Now this bacteria is one that it's normally when that sometimes when you cut your nerve in your hand or leg, it will grow, but slowly growing, but take about 1 centimeter per week, like it gradually grow. But in sometime
it heals itself.
It heals itself and it grows along that nerve pathway, but not the leprosy. Now leprosy can affect the nervous system as well. How it happen? This bacteria grows into a nervous system and they destroy the nerves. And now I'll explain to you what happened in the pathogenesis of the leprosy. Once you see this lesion, and now the bacteria will grow into that and they try to invade into our body. Our body will react against that, and there's a thing called granulation tissue. That means there's both sides are fighting, our body is fighting against it and they are trying to invade us. So there's a protective mechanisms, and that protective mechanism causes the destruction of the area. What happens in this?
Sometimes people might end up losing their fingers.
That's right. That will come to later.
Right.
Initially, what happened? The lesion, the nerves sprouts are coming. When you touch your body, you feel the sensation. What happened? The nerves are there. Nerves will be damaged because of the system, and then main thing is when these lesions are there, you can't. In leprosy, you don't have the sensation, and even if you touch it, you feel like there's no sensation at all.
So you don't feel it at all.
You feel like
kind of like numbed.
Numbed in the sense, but you don't notice it unless you are specifically looking for that specific numbness. Other thing, the destruction part extends not only to the skin, nervous tissue, it extends to your hair follicles as well, and you don't get hair follicles on these lesions. But everything comes. That's a sign that but doctors will notice that. But sometimes you might not. You also might notice the person with a hairy body, you have a lesion with no hairs, right? Then you think of leprosy as one of the case. But mind you that this not only that, this is mainly because of the destruction of all the structures in that skin area. Now you won't feel that area. There's no hair follicles, there's no hair in that, and there's no sweating, and the wound is big only, the lesion is big only, you will be able to clearly identify that area is not sweating, but the small one you are not be able to see. But these are the main characteristic feature of a lesion, of a leprosy lesion, the dermatological lesion, where you don't have a hyperpigmented patch, but don't think all the patches are hyperpigmented. Sometimes become reddish even, sometimes being elevated even. That also possible. But common things are hyperpigment patch with no sensation, no hair follicles, no sweating, and then it's not only one single lesion, maybe multiple, maybe in both sides, up in head, toe, anywhere you can get the lesions. So
Right.
that is an initial clear picture of the leprosy lesions. But same time, what can happen is the nervous system. If you can show to this slide, the people these are the neck nerves.
Yeah.
These are called great auricular nerve. These nerves normally you can't palpate. It's there in your body, but you can't palpate it. But these people, the leprosy patients, these nerves are being enlarged. It's a rod-like thing.
And it's visible outside.
And visible outside. Now this since been extended this head, you can see it clearly. But
Right.
when you keep your head straight, it's not visible. But if you touch it, you can feel it like that's a rod-like thing.
Okay.
So those are the signs and symptoms of lesions. Without doing any without doing any extensive diagnostic procedure, you can see this could be a leprosy lesion.
And doctor, what are the extensive diagnosis methods for leprosy
now
to identify whether
I-
someone has got it?
Actually, our dermatologists are very good in diagnosis leprosy because they have been exposed to so many cases, and they can, once you see a lesion, they can diagnose it. Or otherwise, you can take a biopsy. You can take a punch biopsy, or you can take a slit skin mear. That means just take a scraping of that area, and then you stain it and see. Now, with all this thing, now all these lesions and everything, now you don't have any pain or anything now. Now, since until up to this level, say now he doesn't have he have a lesion.
There's an incubation
Period
period
and everything, but we have a lesion. Sometimes people are going around, all around with lesions all over the body. You can see some people have without the shirts, and you see so many patches are there, but noticing they don't know that they are having leprosy. But these people are spreading, mind you, and then they are walking, and what will happen if they are not being treated at this level? So if they are not being diagnosed, they are not coming to the doctor, because when the patient comes to the doctor is the pain. You see, the pain is the brain and butter, the bread and butter of the doctors. So when there's no pain, people doesn't come to the doctors. They say it's nothing else.
Until they are uncomfortable, they don't come.
What will uncomfortable thing comes? This. The next slide comes.
Okay, we'll have the slide on screen now.
Yes, this what happened when the same thing happened to your the nerves that supply the last two digit, the fourth and fifth. They are the one who are affecting commonly. Once it affected, you can't bend your last two digits. These have been paralyzed. Right? Initially, you get the tingling sensation, like tingling, but later on, you get paralyzed. Then what happened? You can't clench anything first, and you can't write. You can't pull up anything. You can write in the papers, right? So you can't hold a pen. So everything is needed. All these 5 digits. But if you lost these 2 digits, that means you have been permanently disabled due to leprosy, right? Same thing had happened to your legs.
Oh.
Now, what happened to your legs? Legs muscle get paralyzed. What happened? On this picture, you saw this is called the leg drops, foot drop. This is called foot drop. Foot drop in the sense normal. This sort of actually these patients are there now. If we go to the hospital and there are patients, but now since the doctors have been educated on how to identify this thing, the treatment is available, we don't have to go up to this level. So what the anti-leprosy campaign, what we are trying mainly is to tell the people, if you have a lesion like this, don't think this is just a pus varga, like a fungus thing. Just go for the doctors and just show them
any kind of lesion.
any kind of lesion. And normally what they see the leprosy, they see this. When you, this is the final outcome of a patient. This losing all digits, sometimes you are losing from below elbow even. So
that's because it doesn't work and there's no circulation.
Just in the sense, now what happen is when you get a skin infection, and if now here the skin is there and there's no subcutaneous tissue much in your digits, from the skin you get the tendons and then the bones. If the infection is there, now since you are lost, the nerves get damaged, you're going to get the sensation. You touch hot things without knowing that you touch the hot plate or something like that, then you get damage, but still you don't know whether the damage is there, but it is exposed. That means the wound comes there and you get a bone is exposed and get condition called osteomyelitis, that the infection is the bone and the digit fall. One digit by digit it gradually falls and it happen to the legs as well as your hands. So that's how you're losing your both feet and both legs.
So that's like the extreme condition.
Extreme condition that I'm repeating. We won't see these patients now because of the treatment is good. And not only that, this can affect your eye as well. Thing is, when the eye is closed, because there's a nerve.
Because it's all about the central nervous system.
Is good that you ask that question. It is not the central nervous system, the peripheral nervous system is affected.
Right.
Central nervous system is the brain and the spinal cord. They are living in underneath your body. The peripheral nervous system is where in your the superficial to your surface. So that is the system that is being affected. That is the peripheral nervous system. Central nervous system is spared on this thing. So therefore, the eye, you can't close your eye because of that. Then what happened? The eye is open when you are sleeping as well. Then what happened? Your eye is getting dried up because you don't. When you are blinking, your tears are coming. When you can't blink, what happened? The eyes get dried up.
It doesn't get hydrated.
Hydrated. That's right. When you are blinking, it's gradually hydrated the cornea, the black color part that you are mentioning.
Yes.
And if it is not hydrated, what happened? Brain dried up. That's a condition called keratomalacia. That means dryness and condition in the cornea. And then you get corneal ulcers, the corneal wounds. Later become blindness. So that's a scenario. Now
so
see
leprosy can lead to many different diseases.
Once you see a final picture prior to 1950s, I'm considering 1950s because that's a game changer. Starting the treatment called Dapsone at that time, and with that we were able to completely cure the leprosy by 1950s because of starting the Dapsone treatment. And prior to that, we see a picture like this. Now people also know that person now losing that part, this part, because everybody is helpless. Even the doctors are helpless. Everybody is helpless. They are keeping in a quarantine place. They can't go out. If the wealthy person even they had disease, what happens? They have to will and give to somebody to outsider to manage all the property. Then he has to inside. It's a forcefully you are keeping them inside. Now luckily because of the treatment availability in 1950s, that's called Dapsone. That's a game changer. Started the treatment, and with that they have managed to completely cure the leprosy.
And how long does this take, doctor?
Yeah, the thing is now there are what happened in 1950s is starting with Dapsone, but the tablet, the treatment continues. And then 1970s what they found is there's resistance comes to this bacteria. The Dapsone treatment. So what they did is they put include other medicines like rifampicin, clofazimine, like other medicines are included into that. Then it can become multi-drug therapy. So it's called MDT.
So then they don't. It's not contagious then when they are consuming the tablets.
That's right. As soon as you take the tablet, within 2 days, you are not contagious to anybody. So as soon as you take the tablet, you are not. You can stay at home and take the medicines. Now, when you are diagnosing leprosy patient, that you are not allowed to quarantine at hospital anywhere. We said we have been diagnosed with leprosy. These are treatment available, and the treatment. I'm showing you a picture of the treatment schedule that we are having. So these are the packet. So this one packet per month, like person, and once you continue this tablet, you will be completely cured, and you are not spreading to other persons as well.
Doctor, I think it's not only about saving them, it's about protecting the others as well when they come and get themselves treated, isn't it?
That's right, yes.
So we've come towards the latter part of the program, and with this question we have to wind up the program as well, but we will be continuing on this topic on our following segment, which is next week. Thank you so much, Dr. Kapila,
Thank you
for being a part of the show.
for inviting me. Thank you.
And with that, we conclude this week's edition